Welcome to Community Watch. Today, Greg and I will be talking to President and CEO of Floyd Medical Center, Kurtz Tonko, about the pandemic and what's going on locally with that. And today is Thursday, April 16th. That's the day we're taping. Stay with us. Community Watch starts now.
Welcome to Community Watch, and today we'll be talking with the CEO of Floyd Medical Center, and we're talking about the pandemic and how it's affecting residents in Floyd County and Floyd Medical Center. Doc, how you doing?
I'm doing just fine. It's good to see you.
Yeah, under the circumstances, yes.
So I'm fist bumping. Is that the new tradition? Although I'm not really sure we would be allowed to do that if we were physically in the same location.
Yes.
But as you say, our guest is President and CEO of Floyd Hospital, Kurtz Tonko. Welcome to the show, sir.
Thank you.
It's great to have you. I know you have a lot going on, so I appreciate you taking some time with us. Tell us, to get started, I think it was, surprising to a lot of us that Floyd County became kind of a center for occurrences of the virus so quickly after Atlanta. Was that a surprise to y'all or as well?
Yes, it was. We early on got a case, and then of course we all know what happened in Bartow County at Life Church. And so a lot of those folks that had exposure at that church and Life Church in Cartersville were also Floyd County residents. So we saw some of them as well. Our very first patient, we believe, came in contact with a positive patient on a trip that she attended in Washington, D.C. And then when she came back to Rome, she presented as very sick in our emergency department. And we were among the first on the East Coast to diagnose a patient that had a community exposure. And what is meant by that is that at the time, the only tool that we had to screen people, as provided to us by public health, was to ask, had the individuals ever been to one of the suspect countries, China, Italy, et cetera, et cetera. And she answered no to all of those. And public health said, well, she's good to go. She's not likely to have it. But our radiologist, after a chest x-ray and a chest CT was ordered, our radiologist reviewed those imaging findings and said, this looks like what we've been reading about, and we need to be cautious. And then a few days later, now this is way back in early March, she was tested as positive. So long answer to your question, yeah, we were surprised to have one of the first. And then that experience in Cartersville, just added to it.
I know we were having a conversation with Tim Harrington, and I at least was a little surprised to know that he had already, and his office had already had some pandemic training and preparation 10 years ago. And I don't know, is that something the hospital commonly considers and discusses and thinks about as well?
Yes, absolutely. In fact, I just had a feeling about this, that we needed to be ready early. And, I don't know, call that a sixth sense. I encouraged our team, let's review our policies and procedures, because it could happen here at any time. I mean, you think again back to early March, We had people all over the nation that were saying, "Oh yeah, go out, go to parties." We had Nancy Pelosi in Chinatown saying, let's celebrate. We had Bill de Blasio in New York City saying, this is great. Let's celebrate our heritage. And that was when all of this was spreading throughout the United States. So you got to think back to, how people viewed things back then. And so we thought there was little likelihood in Northwest Georgia. But again, I just had a sense. And it's not just my sense that caused us to be ready. I mean, we're also a regional coordinating hospital. And as a regional coordinating hospital, one of several throughout the state of Georgia, we are in a constant state of readiness. We drill and we train. We train for mass shooting events. We train for pandemics. And so as we go through these drills, where sometimes we actually stage the drills, other times we do them on paper. And we think about what are all of the resources that we have to have ready and in play in the event something like this happens. So that kind of training, that kind of constant remembering and thinking about how we ought to be prepared puts us in good stead. So we've been in good shape for this.
Kurt, I got a question. I know in the community, you always hear a lot of different things going on. So what is the state of Floyd Medical Center itself? Do y'all have a separate wing? How are y'all dealing with positive cases?
Yeah, that's a great question, and I appreciate you asking me that. And I also know some folks in the community now, they may be worried. They say, well, gee, Floyd is restricted visitation, and so is Redmond. So is that a dangerous place to go to? And actually, the main reason we are restricting visitation is because of social distancing. I mean, we don't want a lot of people in our organization actually bringing things in because, all of our personnel are practicing social distancing. They're wearing the proper protective equipment with the gowns and the masks and the face shields. And our organization really is probably one of the safer places to be, a lot safer than going to the grocery store. But to answer your question as to where we're taking care of patients, we are taking care of patients in negative pressure rooms so that air doesn't recirculate throughout the whole organization. So again, thinking about the safety, we've put patients who we already know are positive and have COVID-19 in negative pressure rooms, and for those that have signs and symptoms that we're still waiting for the test results. And I don't know if I'd call this fortunate, but we had a hospital wing, the old Kindred Hospital that has since closed down, attached to us, which is a new facility and vacant. And so that is where we have been putting most all of the patients that have testing positive and those patients for whom we're waiting a test result. So we've got them segregated, most all of them in that wing.
Have you had all of the supplies that you needed? We're hearing a lot about hospitals around the country that are struggling with, masks and, protective equipment for their staff members and medical teams. And I wondered if that was an experience Floyd Hospital has been having as well.
It's a great question and a very pertinent question because you're absolutely right. There are different hot spots in the country where they are running low. They're running low on masks. They're running low on face shields. They're running low on the gowns. Our supply chain executives and personnel have done an amazing job in sourcing equipment from all over the nation, all over the world. And at this point, we're in good shape. Now, if the trend starts going up at Floyd, it's going to increase the usage. But right now, we're in very good shape.
Kurt, from your perspective and your team perspective, I sometimes get the feeling that here in Floyd County, we still may not be taking it as serious as a community because you do see a lot of people out. So from your perspective, where are we in terms of a community? The social distancing, is that something we should be following it, but do you feel like we're taking it serious as we should be?
Well, we should take it seriously. You're exactly right, Greg. We've got to follow these guidelines. If we don't, the disease spreads person by person. I mean, that's the way it spreads. So if people are in contact with one another, in areas less than 6 feet. I mean, we need to be apart. We need to be apart so we don't cough on people or sneeze on people. And, maybe even 6 feet isn't far enough. I mean, but we absolutely need to be doing that and following those guidelines and washing our hands repeatedly, using the alcohol sanitizing. It's very, very important. And I think we've probably done a better job in our community than a lot of places, but we got to be diligent. If we're not diligent, we're going to fill up our hospitals with sick people. And, the statistics are showing if you get it, 80% of the people get better. 20% of the folks may need hospitalization, and most of them will get better, but there is a percentage of folks that are dying, and we want to prevent that. And we absolutely need to practice these things. And we can do better. I think we're doing well. We can do better. We got to be diligent.
Now, a lot of what I've been hearing and seeing is that has me kind of troubled as an African American. Is disproportionately affecting the African American community. Or are you seeing that as well with the cases that are coming through Florida Medical Center?
Well, that's a great question. Nationally, you're exactly right, and it's tragic. It's sad, and it's reflective of the underlying health conditions that African Americans have. There are health disparities in the United States. I mean, we're very aware of that here at Floyd Medical Center, and we are trying to do more and more outreach to address those things. But the insidious nature of the coronavirus is that those folks that already have health conditions that compromise their health, it hits those people hard. And it's true that African Americans have higher rates of cardiovascular disease, higher rates of diabetes, and this horrible virus attacks people with those comorbidities and hits them harder. And it's a terrible thing. And I don't have the statistics for us that break things down by race, but now that you've mentioned it, we'll go back and look. But it is true nationally. And it just reflects the health disparities that exist as a society. And the American Hospital Association, and we here at Floyd too, are very aware of that. And this is something that we've got to address on a go-forward basis to address health disparities. And it's a sad situation right now that it is hitting African Americans disproportionately.
I was reading this morning that it also is affecting men to a much greater extent or more seriously than it is women. I wonder if that's related at all to a topic that Greg and I have talked about before, and that is that men tend to not take health issues as seriously.
Yeah, we can speculate on that. I've seen those statistics, and I imagine a lot of health researchers will have things to say about that. I think you're probably on the right track. I mean, for men, our longevity, how long we live is shorter than females. And I think you're right. Men probably don't take care of themselves as well as females do.
I'm wondering, and I know we're coming up on a break soon, but I'm just wondering, or you can tell us as a community, what is there things that we could be doing that would help the hospital in this situation?
Well, that's a great question, and I appreciate it. I drove home yesterday, and I drove by our 6th-level parking deck, and I saw several more banners that people had hung there. We love our nurses and healthcare heroes, and we really feel that community support. There were people parked in our parking lot a couple Sundays ago, and to pray for us and to pray for our patients. And we appreciate all those positive sentiments that are out there. People are also making masks. The CDC changed their guidelines 2 weeks ago, and they said that masks are good to just wear them in public. And so that's wonderful and helpful. People have been dropping off snacks, candy bars and things for our employees, and we appreciate that help as well. So those kinds of things are very much appreciated.
We need to cut for a break here, but we'll be back with our guest, Kurtz Tonko, who is the president and CEO of Floyd Medical Center. So don't go away. We'll be right back.
Your life is filled with opportunities to show the world you can take charge. It's waking up each day with a mission. It's working each day toward a goal. It's choosing to rise. It's charging forward with a purpose. It's changing the course of your life and taking charge of your future. If you're ready to be a Take Charger, enroll at Georgia Highlands College today.
Welcome back to Community Watch, and if you're just not joining us, we're talking to the President and CEO of Floyd Medical Center, Mr. Kurtz Tonko, and we're talking about the pandemic and how it is affecting our community. Kurt, before we went on break, we was talking about what the community could do, and you was talking about how the positive feelings and emotions and displays are really good for the morale. And I know as a community, we're a very giving community, but I would like to go kind of move toward what is it that you would like to, what is it you want the community to know? Because there's a lot of misinformation out, I think. So what are some of the information you would like to share with the viewers about this pandemic?
Well, thank you for asking that, Greg. We've noticed, our numbers are down here at Floyd, and part of this is by design. We stopped doing elective surgical procedures back in the middle of March so that we could save on what's called PPE, the personal protective equipment, the masks and all that. And we built our stocks back up, and we're going to start doing a few more surgeries because, an elective surgery, the fact that it's elective doesn't mean it's not necessary. I mean, it's such that it's not a direct emergency, but these folks need their surgeries. And so we're going to start doing a little bit more of those. But we've also noticed our emergency room volumes are down. And I was at a meeting this week with some surgeons, and one of the surgeons said, there was a patient now that's in our intensive care unit here at Floyd. If that person had come to the emergency room a few days earlier, he said, I could have treated their condition, but they waited 3 or 4 days and now they're much sicker. And so that patient chose not to come. And that's unfortunate because he could have intervened earlier. Another physician shared with me an article that showed that nationwide emergency room volumes are down and people presenting with heart attacks are down. Well, cardiovascular disease has not disappeared. People are having their heart attacks at home. And if you're not seeking care when you have chest pain, or you're not seeking care when you feel numbness and might be having a stroke, you're going to have a worse outcome. And if people are being nervous that, gee, well, I don't want to be exposed to anybody that has coronavirus, so I'm not going to the emergency room, that's really not in their interest. We can take good care of you. I mean, we do screening questions when people come. We screen them for temperature. We screen them if they've had a cough, and if so, we move them off to another side. And if you have signs and symptoms of a heart attack, a stroke, or what have you, you really need to seek care. And that's a message I'd like to get out there because we want to take care of folks, and the sooner the better for things such as heart attack and stroke.
It's interesting that you say that because I was having a conversation yesterday and a person was debating whether or not they should go to the doctor. They had talked to their doctor and he had informed them they need to come in for an x-ray. But they was like, should I go in for the x-ray or just wait? And I'm like, no, if the doctor told you to come in for an x-ray, you need to go in for an x-ray. But that was a conversation I was having just yesterday. So yeah, you're right. People are, some reason we're afraid to go to the hospital because of this, as if the ailments that we have are just going to go away. And I think you're right. It's sad that people are doing that.
Yeah, it is. And, we want to take care of folks. We want to, the best care is the care that you go ahead and get. I mean, delaying it, you could be getting more ill. And so all of the doctor's offices, the urgent care centers, our emergency rooms, we are screening people. And so if you're not feeling well, you should seek care.
Now, I know Doc got a couple of questions, so I'm going to get this in before he gets started. But how did Floyd become designated as the hospital? Because I know we have Floyd, we have Redmond, both are great hospitals, but is it something about Floyd that it was designated as, I guess, like the hospital that treats this pandemic in this area? Well,
Redmond has cases over at their hospital too. I mean, it's COVID-19 doesn't discriminate. I mean, anybody that's got it and goes to an emergency room, you go through the same screening. So Redmond is taking care of folks with COVID-19 as well. And in fact, we have had some coordination between us and Redmond and the Harbin Clinic and other community physicians as to how to approach things. And we may have a slightly larger number because, you know, we're a little bit bigger hospital than Redmond is. We have a larger volume that comes to our emergency department. We have also emergency departments in Cherokee Medical Center in Alabama and Polk Medical Center in Cedartown and Polk County. We also have approximately 50 primary care offices. So we just have large volumes of patients that come to us. As of today, I just looked at the statistics and we have 10 positive patients here at Floyd in the old Kindred building, what we're now calling the Northeast building. And we have 22 that we call PUIs, persons under investigation awaiting tests. And Redmond's numbers are a little bit lower, but they still have some. And then over in Cartersville, they've got similar numbers to what we have too. And so Floyd's a regional coordinating hospital because of our bed size and likewise our numbers of patients that we see.
Well, I'm very curious about, I know that there is a what looks like a temporary structure in the parking lot there at the hospital. And also I'm hearing about the conversion of some of the parking area across the street, across the road and the deck. Is that, that seems like a lot of work for precaution. I just wonder if Floyd Medical is expecting something bigger.
Yeah, that's a great question. And I need to go back about 2 weeks in our whole timeline. And folks may recall that Dr. Anthony Fauci, who is an amazing guy. I mean, you watch him on television. He's the director of the National Institutes of Allergy and Immunology. The guy is 79 years old. I mean, he's still out there active. And he's an amazing guy. He used to be a point guard on his high school basketball team. I identify with that. You know, I'm not a tall guy either, and I was a point guard too. But anyway, I digress. He said a couple of weeks ago, along with President Trump, that they expected 100,000 to 220,000 deaths in the United States. And then a few days went by and they said that we think the social distancing is working, and now the number's 60,000. And so you go back 2 weeks ago, we were extrapolating that data and looking at it here at Floyd, and we said, wow, we're going to need some more beds. We're going to need some more capabilities. So the first thing that happened is the state of Georgia contacted us and said, well, we have this modular unit of 20 beds that GEMA, the Georgia Emergency Management Association, has. Do you want it? And I said, yes, we want it. We want it. So that's going out in our parking lot. And if you drive by, you'll see these round concrete pillars that are out there. That's the foundation for it. And as we looked at our numbers, we said at that time, well, that may not be enough. And so we started thinking, what do we need to put together to meet this worst case scenario? And you think about what New York City and Chicago did, and Detroit. New York City, they converted the Javits Center, Convention Center, into a big hospital ward. In Chicago, they took the McCormick Place Convention Center. And so for us, we said, well, what would make sense for us? We actually thought about the Forum, but then we came up with a great idea. Well, we've got this 2-level parking deck over here. It's got concrete ceiling, concrete floor, and we can put walls in it. And we contracted with Parker Systems here in Rome that does disaster services. Every time there's a hurricane, they go help set up temporary shelters. And so that's what we're doing. And now our current projections show us actually dampening the progression of the disease. So we may not need it. And I actually called the governor's office day before yesterday. And I said, what are you showing for Northwest Georgia? And they said, well, honestly, we haven't really run the numbers for Northwest Georgia. We're focused on Southwest Georgia, which has got a big outbreak of coronavirus. They said, but I'll tell you, Kurt, what I told the governor. It's better to build what we're doing down at the Georgia World Congress Center and not need it than it is to need it and not have it. And he said, so that's what I would say to you. And so that's what we're doing. We're building it, and I hope we don't use it.
So in terms of testing, do you think enough people are being tested? We talked about we talked with Tim Harrington about people having to be on a list to be able to get tested at the drive-through site that they have set up. Would you have a better idea of what was coming if more people were to get tested?
Well, there are a lot of facets to testing and the need for testing. There's not enough. I mean, there are not enough tests out there. We have 2 different machines on order that we just can't get. We have one already here in our laboratory, but we can't get the reagent cartridges that are necessary to put into that machine because there's a shortage of those, and it's nationwide. The federal government has been routing testing to the hotspots. And the hotspots have been New York, New Jersey, now Michigan, and there's a shortage. There's just a shortage of tests, and we need tests for everything. As it relates to the hospital, we need testing, especially if our numbers start to climb, because we want to know where to put patients. So if we put 2 patients that we're waiting for results together, one of them may have it and the other one might not. If they're in a ward, well, they're all going to be exposed to each other. So we need that testing capability. Business and industry needs testing capability to see if people can go back to work. We need testing for so many reasons. And the problem is there's just not enough production of testing and also those reagent cartridges to put into the machines. And we need that very badly. As a nation, as a region, we need it at Floyd Medical Center.
Well, I know that at the moment, I'm sure the medical center is caught up in the events of the day, but I wonder if, once this has, once we have finished with the pandemic, once it's past us, are there things that you will know better next time to do, or things you'll be able to request to have in supply for the future that you've learned through this experience would help you better next time?
Oh, I'm sure that will be the case. After every drill that we do an after-action review. And of course, this is the real thing. And we will do an after-action review here at Floyd. What things went well, what things can we learn from and do better. And we're going to do that as a nation. One of the biggest problems we've had as a nation is the supply chain. I mean, all of our PPE was manufactured in China, and they cut it off because they wanted to use it in their own country when they had their outbreak. Of course, nobody believes their numbers. Their outbreak was probably 10 times what it actually was. And our supply chains were cut off. So we rely upon another country for vital stuff. I mean, that's got to be fixed.
Well, that makes perfect sense. Greg, you got a question? I don't want to dominate too much.
No, I know it's actually got about a minute left, and I was just thinking when Kurt, you was mentioning that clearly after this, there's a lot of new normals that's going to come about. But I want to thank you and all the people there, because I do believe there's a sense that we're safe here because what's going on at Floyd Medical and other places. But I think y'all have done a great job so thank you for what y'all have done and your leadership in this.
Well, I appreciate that. One of the things that's been amazing to me is how people here at our organization have just pitched in and done a magnificent job under incredible circumstances. From the caregivers to the supply chain people to all the logistics people, it's just been an amazing experience.
Well, thank you so much for joining us. We're about out of time, so we'll say goodbye, but thanks so much for joining us.
My pleasure to be with you.
All right. Bye now, everyone. We'll see you next time on Community Watch.